Hi, everyone, and thank you for tuning in to this recorded webinar. This webinar is intended for providers, and as a quick reminder that we are all in this together, we appreciate all of the help and the critical support that you're continuing to provide to Connecticut residents. And the objective of today is to go over a few items about what 211 is doing as part of the state's emergency response framework, some information about the COVID-19 public information line, a quick overview and a live demo of our 211 resource guide of community-based programs, a reminder on how to make sure that your resources and your agencies are updated so that we can make accurate referrals to those critical services that you're continuing to provide. And then just once again, a reminder that we appreciate everything that you're doing and that we're in this together. My name is Andy Scully. I work in United Way of Connecticut 211's Community Results Center, and I am recording live from West Hartford, Connecticut. I'm joined by my colleague, Kate Quigley, who is the lead information resource specialist in our information services department. And she's also recording at a safe distance in her apartment in another part of the state. So let's get rocking and rolling. 211 is part of the state's emergency response framework. So what that means that during times of emergency and disaster, we serve as a gateway to services. Some of our functions include, but are not limited to, information dissemination, rumor control, connection to programs and services via our community resource database, situation reporting. We currently are participating in daily situation reporting with the entire emergency response framework, volunteer and donation data collection, call trend reporting and data collection, temporary hotel placements, transportation coordination, case management coordination, and then staffing at the state's emergency operations center when safe. This diagram just shows you a little bit of the flow of information and how our 211 call center, our information services department, and then you as community resources, as agencies that are reflected in our database, can help to inform decision-making across the state and help vet and ensure that the information we're providing to our help seekers is accurate and consistent. So the state's Emergency Operations Center, EOC, relies on 211 to disseminate consistent and accurate information, to connect help seekers to the community resources in the 211 database, to track and report call trends and unmet needs to the EOC, to track and report rumors to the EOC, and to dispel rumors once confirmed by the EOC. So as you can see from this flow chart, information starts from the Emergency Operations Center, but there's really a back and forth flow. So our 211 Information Services Department collects information from the call center. So every time our help seekers dial 211 to ask questions about different rumors they've heard, to report information they've heard or they've seen, we then flow that information back up to the EOC to confirm, to vet, and then to be able to supply that consistent and accurate information back out to the general public. As you can see, we also rely on our community resources to update their agency listings. So right now we know that many of the agencies in our database are limiting their scope of services to ensure the safety of those that they serve, as well as of those that work at those agencies. So please do your best to let us know if there's any changes so that we can continue to have that accurate flow of information. On March 7th, 211 was asked to stand up the COVID-19 public information line. And since launching that special line, we've handled more than 16,000 calls, and our hotline's pre-recorded messages have been accessed more than 22,000 times. We know that many of you have dialed that number. As you know, there's some frequently asked questions and some pre-recorded messaging you can access, but there's also that option to connect directly with a contact specialist. So 211 contact specialists are documenting callers' needs and reporting call trends, rumors, and unmet needs to the state's Emergency Operations Center using that flow of information that we just covered. This data is used to inform announcements from the governor's office, to inform gaps in services, and to help decision makers make informed decisions about how to allocate available resources within the state. So now I'm going to turn the mic over to Kate, and she's going to cover 211's resource guide of community-based programs, which is now available on the 211 website. Take it away, Kate.
Hi, everybody. This is Kate Quigley. As Annie mentioned, I am our lead resource specialist in our Information Services Department at 211 Connecticut. I am safe and well at my home, practicing social distancing practices here. I'm going to walk us through the website today to highlight some of the resources that are specific to the coronavirus COVID-19 information. So first and foremost, if we visit our website, 211ct.org, you will notice that there is a banner at the very top that says coronavirus COVID-19. That's a good place to start looking up this information. I do also want to note that any of these pages can be translated into various languages here by just choosing one. The entire page and the links and resources within them will translate if that is something that is necessary for you or the folks that you're working with. So here from the coronavirus information page, the first thing that I just want to let everyone know about is the ct.gov/coronavirus website. This is the state's website that has the most recent guidance and updates related to the state's response to this crisis. They are doing an excellent job of keeping this website up to date on a daily basis. It has everything from statistical information about coronavirus cases to press release information from the governor. So that is a really good resource to stay tuned into for the most current updates. We at 211, as Annie was mentioning, we are really serving as the public information line to answer general questions about COVID, but also getting folks connected to community resources as we would do on a regular basis as our role as the 24-hour information and referral line for Connecticut. So on this page, I'm going to jump into the resource guide in a second, but I just want everyone to know that there are some volunteer and donation opportunities, and we give some details about that here on this particular page with the corresponding links. If folks have donations and they want to fill out an online form, they can do that here. Also for medical volunteers and other volunteers, there are some options for those folks as well. We're going to click on the 211 resource guide of community-based programs. And up front, you're going to get just a little bit, again, pointing back to the state's website, a little bit of instructional information, and then some categories that you can click on and it'll bring you right into the category, or you can just scroll down on the page to see the full resource guide. What I'm going to show you here is the frequently asked questions first that are uniquely related to COVID-19. These are the information contained in these FAQs has been provided to us by the State Department of Public Health, as well as some information from the CDC. And so some of the recorded messages on the upfront phone queue when someone calls 211 are also the same as what is here for some of these. And this is the information that our staff are sharing with the general public when they come in on that line. So for example, how do I protect myself from COVID-19? You're going to get a resource card that looks just like our regular resource cards that hopefully all of you are fairly familiar with our website in general. You're going to get some bulleted information. You're going to get a lot of external links if that's something that you need to do further research. So this one goes to the CDC. There's also some precautionary measures that folks can take. So really, we're trying to keep this information as simple and concise as possible when we receive it from the state so that it's easy for folks to understand. Within this particular record, if you scroll down, you'll see that we are updating this every single day. I just made an update this morning, but all of the other associated programs related to COVID are here. So if someone needed to know about travel advisories, or someone calls us and they say that they're sick, what should they do? There's specific guidance in that particular program. A lot of questions about masks and gloves, vaccine treatment, testing. So hopefully you see there's 42 programs here that we keep adding information to daily. So what I'd like to stress is that all of this information is subject to change at any given moment based on how much information we're getting from our state partners, or, you know, as Annie talked about, we're hearing rumors, we're passing those along, we're either confirming them or dispelling the rumors. So anytime you're checking this information, just know it may be look a little bit different than what you may have seen a couple weeks ago, because it is always changing, okay? I'm going to go back to the resource guide here. I'm going to show you one section related to food. So food and nutrition is one of the tabs up here, and it brings you right to this section. We're doing a lot of work in my department, Information Services Department, in terms of working with Connecticut Food Bank and Food Share to keep the food resources updated, because in light of the COVID-19 crisis, a lot of food services, soup kitchens, food pantries, they're unable to serve due to lack of staffing or volunteers, either due to, you know, illness or other reasons, or just trying to keep safe social distancing practices in place. So for any of these programs, but really most importantly, the food programs, the guidance that we're telling our contact specialists in our call center, and that we're also trying to communicate to the general public, is really to call ahead to any program, to confirm the hours, to confirm the service delivery, because we would hate for someone to go down to a service where they are technically closed and maybe we haven't learned that yet. So if you're looking at resources, the guidance really should be call ahead to confirm if they're open, to confirm any changes that they maybe have made and to their service delivery. So there are some mobile food options that Food Bank and Food Share does provide. So that information is here. I'm actually going to click this link and go back into our website. So this is going to be both for food pantries and soup kitchens statewide. It's going to be a pretty large list at first, 449 resources. But on our website, you then can narrow down by a zip code, an address, or a city or a town. I'm going to put in Meriden, and then I'm going to search, and it's going to narrow that down to a much more manageable number of 18 results. What I did just want to speak to briefly is updating with us and what to look for when you're looking at the information in the 201 database. I'm going to go down here to the Salvation Army of Meriden's listing, and I'm going to click more details because I just want you to see some of the ways that we're modifying this information. So for this one, you see the note in bold that says from the 30th of March, all Salvation Army food pantries have these set temporary hours during the COVID-19 response recovery. Every pantry will be open Monday, Wednesday, Friday, 9 to noon. So if you're looking up information for people you're working with, please just check the descriptions and the notes, because we have made a lot of modifications to these resources, not just food, some other resources too, but mainly food resources. The other thing is, if you are looking up either your program or a neighboring, agency's program that you expect to find in our database, if it doesn't come up on the list, it can be assumed that they are closed because we've made them inactive, because we have been alerted to the fact that they are closed and unable to serve. Whether we get that from the agency directly or Food Share or Food Bank, that's our process right now. So just be aware of that, especially if you have a good handle on your community resources. If it's not on our list, it is implied that they are closed and we have made them inactive until they can reopen. Okay. So the other piece here, let's say you are someone that works at the Salvation Army and this has changed. This listing button right here will get you to two options. So I'm logged into my 201 account, which I hope all of you have, and if you don't, I'll speak to that quickly in a second. So if I wanted to publish a note onto my record here for the Salvation Army that we were closed, we could do that, right? So it will show up publicly for anyone to see that they are now at this point closed. Or you can suggest an edit, which then brings you to this form, which will make its way as soon as you hit submit to my department for our review. And it's already all queued up with the food pantry for Salvation Army. You would just write, change in hours. Once you hit submit, we get that. We will confirm it and then make the change in the database. And within 15 minutes, that information is then updated on our site. Okay. So we really encourage you now more than ever to update with us. We are working really hard at trying to get a grasp on all of the changes in services, but we need all the help that we can get now more than ever in light of this crisis. So even if you know of an agency that maybe has closed, but you still see them on our list, even if you don't work for that agency, that's fine. Submit the update to us, please. We will research it. We will call the agency. We will reach out as we need to confirm it and then take care of the update. We appreciate you helping us with this effort because we know at this time these services are more critical than ever. So in terms of the My 211 account, I'm logged into my account. If you don't have one, there's a way to sign up for one. I'll show you that in a second. We can create resource lists with a My 211 account that can be shared or posted. I have here, I just made a list the other day of all the social services departments statewide. If I wanted to share this with someone or print it, all I would have to do is click print and share. I can email it, I can text it, I can copy the link and pop it into a newsletter. And then you have access to those resources that are staying alive and updated within the list. The list can be saved for an indefinite amount of time. I'm just going to log out here real quick. If you don't have an account, you can sign up for one right here from the home page. All we need is an email and a password, and then you're in and you can start creating and sharing lists, which may be helpful, especially now that we can't see people in person as much, to email resources to them so that they know what they can do and who they can call. With that, I think I am going to pass it back to Annie.
Great, thanks,
Alrighty.
Kate. And let me start our slideshow again. Oops. Thank you for walking us through that. And as Kate said, now more than ever, we know that many of you are working hard to continue to serve the most vulnerable populations across the state. So we really do appreciate the work that you're continuing to do. And our database is powered by you, so it's only as good as the information in it. So we really do rely heavily on our nonprofit partners across the state and on agencies like you to provide those necessary updates so that we can make the best referrals possible to the help seekers that dial 211 and make that information also publicly available on our website. So when we follow up with this webinar recording, we'll send you all obviously this link, but also a copy of the slide deck, which has some live links into our database and some more information about how to update your agency listing. And just a reminder, we really are all in this together. We want to remind you guys to check back in with the ct.gov coronavirus website and the FAQ. Those two sources are the best place to go to for the most accurate and updated information about what the state is doing in response to this pandemic. Also check in at the CDC website to confirm any information you might be hearing. Those two sources are obviously the best places to go. The quick demo that Kate gave you of our online resource guide, there's a link to that on this page as well. We encourage you guys to use that online resource guide and to share it with your partner agencies and to those individuals that you serve. Once again, knowing that a lot of the resources maybe have a limited scope of service at this time, so always call to check in before you arrive at a location to make sure that that service is being provided and to make sure you have the correct hours of operation for that service. We also want to remind you that we are here to offer extra support if you do have a case involving a resident with critical needs. So there's information on this slide about how to escalate that situation to our information services department. And finally, thank you. The current COVID-19 public health emergency really is creating a labor crisis for healthcare facilities and nonprofits across the state that serve the most vulnerable people on the front lines. Kate pointed out those two opportunities to sign up to volunteer. So if you or people you know are healthy and able to provide that volunteer service right now, please don't hesitate to do so. There's opportunities for medical and non-medical volunteers. And there's also a donation platform where you can donate PPE, protective equipment that we know all of our frontline services are in desperate need of right now. So we know that many of you are continuing to provide these critical services. So thank you. And teamwork really does make the dream work. So help us help those people that you serve by providing us with those agency updates and letting us know about any critical situations that you're currently experiencing. So once again, thanks for taking time to watch this webinar recording. Please stay healthy and stay safe, and we'll get through this together. Thanks.
Thanks, everybody.